Wake up. It's the Sleep Unplugged podcast, episode 124, Grief and Sleep. Won't you stop and remember me? Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I'm a neurologist, sleep specialist, and your host for this episode of the podcast. If you are new to the Sleep Unplugged podcast, welcome. If you're a veteran, welcome back. If you would like to get in touch with the show, you can reach me via my Twitter and Instagram channel. That is Dr. Chris Winter, Twitter, Dr. Chris Winter, Instagram. We have a YouTube page where we post video content of all of our shows. We also have a Spotify music playlist where we put the musical selection for each show on the playlist. And I think this week is a special one. It's been a long week. A lot has happened. Not the least of which is a special person in our family has passed away. And I've thought a lot about grief over the last week and thought it would be a great topic for our show because grief is something that comes for us all. And I think that the interplay between grief and sleep is probably something to talk about, particularly on this Monday, which is the first Monday of November. So we have a lot to get to. Before we get to the show at hand, just a reminder that Maeve will be doing a virtual yoga session through Integral Yoga New York. That's ININY.org. You can find her pre-sleep yoga class, which is the 7:45 to 9 o'clock every Monday night. So I hope you'll join us with that yoga class. A great way to sort of start the Monday off right when it comes to sleep. I want to give a big shout out to the Los Angeles Dodgers. I couldn't be more excited that they won. And wow, what an amazing victory for that organization. I don't think I've ever seen anything quite like that game five. It was a really exciting playoff, and perhaps this episode on grief will help the New York Yankees because I think they have a lot to be sad about. That was a tough, tough way to end a series. Elections coming up. I hope everybody who's listening to this podcast has voted already and will vote. And we have just gone through daylight saving time. The only thing I have to say about daylight saving time at this point in my career is check out Save Standard Time. It's really time to get rid of daylight saving time. The healthier situation is standard time. Read up on it, educate yourself, make some noise, and maybe we can get rid of this time zone change. And I don't have to answer reporters' questions ever again in my life about what are some simple tips and tricks for adjusting to the time zone because we won't have it anymore. We'll all just be on standard time. Got some great episodes of the podcast coming up. We did a podcast episode, which was a book club with Andrew Spector's book, Navigating Life with Restless Leg Syndrome. Our next book club book will be The Sleep Apnea Hypothesis by Brandon Peters. Please take a look at that book. We'll announce that episode coming up soon. So I'm going to dispense with comments, corrections, criticisms this week. I just not feeling up to it. But I will talk about the lyrics of the song, and the inspiration for the title. Won't You Stop and Remember Me is from Simon Garfunkel's song Hazy Shade of Winter, which was off their fourth album Bookends, which came out in 1968. Simon Garfunkel only released 5 albums, which surprises a lot of people. I think Fleetwood Mac released 9 before Lindsey Buckingham and Stevie Nicks ever even joined the band. It was a relatively short dual career. Garfunkel went off to star in some movies, and Paul was interested in his own solo career. But Bookends and Bridge Over Troubled Water are 2 of my favorite albums, and it's hard for me to pick which one I like best. And Hazy Shade of Winter is a fantastic song. The whole Bookends album was sort of a concept album about life and death. And I've thought about that album a lot this week. We lose people in our lives. We hope that they live long, interesting, fruitful lives, and it's interesting to kind of examine a life from the beginning to the end, and Bookends really kind of put that together in an album if you listen to it in its entirety. Of course, Hazy Shade of Winter was recorded by the Bangles for the soundtrack of the movie Less Than Zero. And it was one of the only Bengal songs that the entire group sang. There was a lot of conflict in that group because the studio always wanted Susanna Hoffs to sing lead because she was sort of the big attraction with that group, and it caused a lot of strife within the within the Bengals. And so, but that's one of the few songs that they all sort of democratically sing together. Although Susanna Hoffs has a little extra part of the bridge that she sang by herself. So we'll put Hazy Shade of Winter by Simon and Garfunkel on the Spotify music playlist. If you're listening to Bookends, I hope you'll check out the song America, which is fantastic. Bridge Over Troubled Water. We could have taken some songs off of that. One of my favorite songs on the album is Only Living Boy in New York, which is an amazing song too. So anyway, here, a shout out to Simon and Garfunkel. So I wanted to talk about grief and insomnia and sleep in this podcast because it's something that we see a lot clinically. And I think that there are many ways that you can think about grief when it comes to sleep. I think that often we think about grief as being a precipitator of insomnia. In fact, it's interesting when you talk to people about sleeping pills or you read recommendations about sleeping pills, grief is often one of the reasons we feel sleeping pills are acceptable. Well, we don't like sleeping pills and you shouldn't use them. But in an acute situation like grief, it's okay. And it's interesting when you think about that because generally speaking, it's okay because it's about the only thing you can really do. I don't think that a person enmeshed in acute grief is really ready to get down to the cognitive behavioral therapy work that needs to happen to treat somebody with insomnia. So, in that raw situation, I do think it's probably an acceptable thing to help people with. And you can sort of dispense with, we could talk a lot about, how bad is the sleep in a grieving person? To me, when you read the research, it's a little bit surprising how it is worse than the non-grieving individual, but often not by a lot. When you actually look at sleep study data on grieving individuals, it's often subjectively terrible. Objectively, it separates itself from the control group, but not by as much as you would think. And it's been suggested that grief really impacts and can prolong the symptoms of insomnia. But I think it's also important that we think about, particularly in prolonged or complicated grieving, that the insomnia at some point in that process starts to take command and it's driving the grieving process. It's preventing that grieving process from softening for resolution to be found. Although one study that I saw looking at grieving parents, I think it was a study kind of followed parents that lost children to cancer up to 5 years. And the study basically said, we don't see, we see a lot of parents that at the 5 year mark are still struggling psychologically with the death of their child. And that prolonged grief can have effects on individual sleep well beyond the 5 year mark. And as a clinician who does have grieving parents in his clinic, I find these to be at times some of the most malignant, difficult to treat insomnia patients because you can't really treat the underlying problem. I, Cognitive behavioral therapy in some part rests upon a rational dissection of the problem. And as I've processed my own grief over the last week, you always circle back to the rational realization that this is something that cannot be undone. There is only moving forward with this radical departure. And I think when you are dealing with somebody who is struggling with complicated grief, I think it's very difficult for the average sleep doctor, certainly difficult for me, to help a parent get beyond the grief. That is really outside of my wheelhouse. I can tell you that your sleep is probably okay. You might be sleeping better than you thought. We can go through all the different exercises of, sleep hygiene and exercise and consolidating sleep, everything we talk about in the show. But at the end of the day, this person that was extremely meaningful to you and that you loved and cared for and protected is no longer with you. And that is a big stopping point when it comes to sleep. So I think recognizing this podcast, as I think about it, is becoming this sort of bidirectional podcast. I feel like every week, particularly with the insomnia, it's always, well, the sleep and the insomnia worsens grief, but the grief worsens insomnia. Fear of the dark makes it difficult to sleep. The more difficult it is to sleep, the greater your fear of the dark is. These reciprocal relationships never stop fascinating me in a lot of ways. When you dive into grief, beyond the complicated grief, there is another grief that has been very real to me this week, and that is something that's often called late life spousal bereavement. It's often abbreviated LLSB. And that's almost treated separately. And I'll tell you, there's not a great deal of research on sleep and bereavement or sleep and grief. And this is a very interesting subcategory of grief because it's two individuals that have kind of linked themselves together. They're caring for each other. They're operating as a unit, and one of those individuals is gone. And I think the late life spousal bereavement is particularly important because I think it underscores a sense of vulnerability in that population. That the elderly individual who's lost their partner might feel a bit of fear or anxiety just in the leading of their own life, their ability to operate now without their significant other, that I think is extremely important. And when you look at late life spousal bereavement, individuals who lose their partners had an odds ratio in one study, it was a Japanese study, that 1.65 was the odds ratio that you were going to have difficulty sleeping. Hypnotic use was 2.12. So just to give a sense of what an odds ratio is, an odds ratio of 2 would indicate that you are twice as likely to have that problem. So these individuals are slightly more than twice as likely than non-bereaving partners to use hypnotics, slightly under twice as likely to have difficulty maintaining sleep. Although in a similar Japanese study, that odds ratio for, I'm sorry, Swedish study, the first study was Japanese. In the Swedish study, the odds ratio of poor sleep was 1.95. So an individual is about twice as likely to have difficulty sleeping, specifically maintaining sleep, than the individual is not. And we've talked about in previous episodes bed sharing, sleeping with a pet, that sometimes in individuals that can be kind of comforting and create a sense of sleep continuity that isn't there when the dog's not there or the partner's not there. There is a higher senses of grief tend to be correlated with less time asleep, although that correlation can be somewhat slight. It's not a strong correlation, again, as much as one would think. And when you look at individuals with complicated grief, there was a great study, I think it was like 2023, it was a recent study that really looked at the patterns of insomnia with grief. And this paper sort of divided them into three categories. There was resilient, which was about 47% of the individuals in this study. And these are individuals that this loss happens, but their sleep either never changes or bounces back relatively quickly. So half essentially of the people in the study seem to be in that resilient category. And again, as clinicians, I would believe that that seems to be about the number that I would think, because we're often privy to data on our patients before we see them. Or I've had a clinic now for 20 years. You get to know patients. You see them at least once a year to follow up with their CPAP, or a couple times a year if they have narcolepsy, or even more if they have insomnia. So you get to know people. And it's surprising to me when I ask, your partner, I was just talking to a woman the other day, and her husband had passed away, and her faith was extremely strong, and she was almost excited that his suffering was over and he was in a better place, and she was excited about the life she had with her family and friends and the things that she enjoyed doing, but she was also kind of equally excited about joining him. That was her faith, that was her belief. And, I kind of thought about what we've talked about when it comes to insomnia, how insomnia only works if you fear it. So if you're somebody who likes to get in bed and fall asleep, but you also don't mind getting in bed and not falling asleep, you're kind of bulletproof in some ways. And I almost feel like that's kind of how she was. It's if I live another 20 years, I'm excited about that. I'll just see him in 20 years. If something were to happen to me tomorrow, I'm I've lived a great life. I've got people who are around me. She was ready to go. So I would put that woman in the resilient category. And if you're listening, I really appreciate you sharing what you shared with me that day. 43% were recovering, meaning that you're interacting with them at a time where they are trying to go from grief ridden to resilient, or I'm sorry, to recovered, or resilient, I guess. So they're in that process. And then about 10% of the population, which to me was really high, were on sort of a chronic trajectory of complicated grief. And in this study, they felt like one of the ways you could move people from a chronic trajectory, at least into a recovering trajectory, was to target insomnia symptoms in the treatment of that complicated grief. And I thought that was fantastic. And so we're using insomnia therapies that we've been talking about, what, once a month for 3 years now, as a tool for helping to skew the odds to that person moving from the chronic trajectory into a recovering trajectory. And I really, really like that. And we know that these individuals, even outside of post-traumatic stress disorder, concurrent mood disturbances, even mood disturbances they had prior to the grief, prior to the loss, that the greater that complicated grief is, the poorer their sleep is going forward. So, how do we deal with the grief? I love the idea of sleep being a concrete tool that we can latch on to. During a time of grief, you are presented with a lot of communication, posts on social media, greeting cards, friends coming over, and I never look at any of it as being ill-meaning. Some things I think are more comforting than others. And I like the idea as a provider of care for somebody who's grieving to be able to say, I don't, I don't know what to say to you. I could never, you know, it is beyond my power to wave a wand, say some words, and make your grief go away. But I think while that process is happening, let's focus on your sleep. Let's focus on your insomnia. Let's leave the grief over here to the side and focus on the insomnia, knowing that improving that insomnia can, in a lot of individuals, help to improve their grief and maybe help to lessen their load. It was interesting. I in the article about the parents who had lost children to cancer, I want to read some conclusions that the study drew. So I'm quoting this study. Regardless of how many years had passed since the loss, symptom level of prolonged grief, depression, post-traumatic stress symptoms, and insomnia were elevated in all subsamples. Mothers showed higher symptom levels of prolonged grief, depression, and post-traumatic stress than fathers. However, no significant interaction effects were found between years since loss and gender on any of the symptom levels. Let that sink in. It didn't matter how long. The time didn't matter. As one person I was talking to recently said, this is not something that fades. You just adapt your life to it. It's a tree that is growing, through the middle of a house. I don't know. That's a terrible. You don't cut the tree down. It's impossible to cut down. You just build your house around the tree. The tree doesn't get smaller. It doesn't go away. It is something that's always there, maybe growing, certainly not getting smaller. So the conclusion of that study was cancer bereaved mothers and fathers are vulnerable to prolonged grief and psychological symptoms up to 5 years after the death. That's as far as the study went. So the 5 is completely arbitrary. My guess is it could be 25. Findings highlight that bereaved parents may need long-term support, and results deserve further attention in research and clinical care. The grief is not going anywhere. To attack the grief, to minimize the grief, to say something profound to make the grief go away, I think is a fool's errand. I think the best we can do is to support the person, listen to people, be there for people, and give that grief space. It's not going anywhere. Let's not try to act like it's not there. Let's not try to push it to the side. Let it be. And let's start working on sleep with this new reality now in an individual's life. It's the line from the song, "Won't you stop and remember me?" Of course, you're going to remember that person probably every day for the rest of your life. As a grieving person just told my wife, she said, "Not a day goes by I don't think about this person that I lost." Not a day goes by I don't think about this person I lost. So I'll leave you just very quickly. Again, I don't think there's a lot we can do here. We're kind of back to the cognitive behavioral therapy. We're back to treating insomnia. But there was a 2020 study that looked at about 400 people with complicated grief, and they were randomized to several groups, either sort of a complicated grief therapy plus placebo, complicated grief therapy plus citalopram, which is antidepressant all by itself, or placebo. It said sleep improved with treatments. Those receiving complicated grief therapy and citalopram versus citalopram by itself evidenced better endpoint sleep. Mid-treatment significantly predicted improvement on all outcome measures, meaning that if you looked at the trajectory of these individuals midway through their treatment, that kind of predicted how things were going to end up. And I think we see that a lot in sleep. I almost feel like after the first visit with somebody, I have a sense of the way things are going to go. And it can be really hard when you have that first visit and you're feeling like, ooh, I don't see this going in a positive direction. And there's lots of reasons for that we can get into in a future episode. So that's it. I just wanted to put this topic out there because I think it's an important one. I think it impacts a lot of people. And if you're struggling with grief, whether it's something new, whether it's something that happened to you 5, 10, 15 years ago, I don't think it's ever too late to seek help. And if you're somebody who feels that this grief process has precipitated or is perpetuating poor sleep quality, I absolutely don't think it's ever too late to talk to somebody who can help you specifically with the sleep component. And maybe that will eventually help to alleviate some of the worry, stress, anxiety, emotional burden of your grief. That's it. I appreciate you listening. My name is Chris Winter. If you want to DM the show, it's Dr. Chris Winter Twitter, Dr. Chris Winter Instagram. We have a YouTube page where we post the videos of all of our content. We will update the Spotify music playlist with a little bit of Simon and Garfunkel. Please join us Monday nights for the Integral Yoga Institute yoga class to prepare you for Sleep Monday Night with Maeve Winter. And to everyone out there who's dealing with grief and sorrow, know that the people here at the Sleep Unplugged podcast are thinking about you and hope you are taking care of yourself and giving yourself the grace, space, and time you need to heal. Until next week, sleep well.